at 6 o'clock. This is a welcome. This is a joint meeting with the Farmington and Victor Town Boards for a presentation by the Victor Farmington Volunteer Ambulance Corps. First, I'll introduce our staff here, our town board, and I'll ask Supervisor Aaron to introduce his board, and then we'll go right into Jim's presentation, and we have board members here, so we'll introduce them also. I'm Pete Inglesby, the Farmington Town Supervisor. We have Councilman Bowerman, Councilman Ron Hervey, Councilman Michael Casella, Councilman Holtz, and our attorney Jeff Rath, and our town clerk Michelle Finney.
Thank you. I'm Town Supervisor Jack Aaron. To my right, your left, Deputy Town Supervisor Dave Condon, Guinan, Councilman Luciano, Councilman Ed Kohovic, Town Attorney Frank Pavia, Director of Finance for the Town of Victor, Richard O'Donnell.
All right, thank you. And at this time, what we're going to do is we'll have Victor Farmington Ambulance do the presentation. We'll have questions by the local town boards, and then we are also on Zoom. So anybody in the audience and on the line will be able to ask questions after the presentations and after the town boards have some questions. And Jim, the floor is yours.
Thank you. Good evening, everyone. Supervisor Inglesby, Supervisor Inglesby, Supervisor Marin, Town Council members. Again, my name is Jim Hood. I'm president of Victor Farmington Volunteer Ambulance. It is an honor to be here tonight to make our presentation requesting community support for our community's ambulance service. Victor Farmington Volunteer Ambulance Corps has been serving the residents of Victor and Farmington for more than 51 years, and we're all very fortunate to have a legacy of caring and service and sound business decisions that have been made by our volunteers over the last 5 decades. The opportunity that we have this evening to provide a secure future for high-quality ambulance services in our community is a testament to the dedication and sacrifices of those who have volunteered and served at Victor Farmington. As I mentioned, I'm president of the organization. Our agency is fortunate to have a very strong community-based leadership. All of our members, all of the leadership in the agency, including our chief and deputy chief, all have professional degrees. We have a great diversity of experience, including EMS, healthcare experience, emergency service, government, and a significant amount of business acumen. I am a systems engineer by trade. I work at L3 Harris Corporation. I've been there for 31 years. My experience includes sales, engineering management, program management, and engineering. Our chief, who is here, Michael Carlotta, has a emergency management background and a substantial list of EMS credentials. Our deputy chief, who unfortunately is on vacation this week, provides us with exceptional business and administration experience. Our secretary, Maureen Bills, is here this evening. She is a volunteer with Victor Farmington, and she brings governmental and some not-for-profit experience. Community board members include Sean McAdoo. Sean has a MBA and substantial experience in fire and emergency services and not-for-profit management. Kevin Duhamel, who is here, is a director of sales at one of our local companies, Gore Bell. He also has a history of EMS experience at Farmington Ambulance as both president and chief of operations. Dave DeGear, a resident of Farmington, has experience working for Farmington in volunteer fire and is our community farming voice on our board, making sure we keep everything well balanced. Suzanne McCaffrey is another one of our community members. She is a lecturer at RIT and shares her experience in governmental and not-for-profit accounting. Mary Beer is another one of our community board members. Mary is Ontario County Public Health Director, has a master's in public health, over 30 years of experience as a registered nurse, recently received an honorary doctorate from Hobart Williams Smith, and is president of a not-for-profit organization. Ingrid Zimmerman is one of our volunteer board members. She is a former 911 dispatcher and has been a volunteer for Farmington for over 15 years. We have two medical directors, both who are board certified in emergency medicine and practicing in our local hospital systems at RGH and Strong Memorial Hospital. Victor Farmington is a well-managed agency and we are currently operating with a $1.7 million annual budget. Our current budget is nearly completely funded by our patients. The changing dynamics of the healthcare and employment environments make continuing this approach a high-risk proposition. Many local ambulance services in New York and in our area have closed or reduced services to try to manage their bottom lines. So we find ourselves in a situation where the sick and injured in our community are the people who are paying for the ambulance, and we feel that's not right. Everyone in our community benefits from having an ambulance ready when they pick up the phone and call 911. Our businesses, real estate, our guests who choose to shop, dine, and work or be entertained in our community, and even our citizens who haven't called 911 yet, but might need to pick up that phone and make the call. Everyone expects high quality care in our community, and they don't want to have to wait for an ambulance to come from a distance. The budget we're proposing is a 60-40 cost sharing model with roughly 40% contribution from the community to ensure stable, high quality ambulance services for years to come. This will substantially stabilize the business model and provide much needed cash flow during the first quarter of our year when we experience our insurance and worker compensation payments, which make up 7% of our budget, which have to be funded before we see any cash flow from the rest of the business. In addition, I mentioned that during 2020, during COVID, we experienced a significant decrease in calls and revenue during the first quarter during the COVID shutdown. And I don't believe we want to risk our ambulance services based on the volatility that's associated with when 911 calls happen during the year. Our near-term goals are to increase staffing to raise our call coverage. Victor Farmington and Victor Farmington's mutual aid partners cover 100% of our calls. We organically cover 95% of our calls right now. Our goal is to cover above 98% of our calls. Adding a second ambulance during the overnight shift from 11 p.m. to 6 a.m. and a third ambulance during daytime hours from 6 a.m. to 11 p.m. will achieve that goal. We also need to enhance employee compensation and benefits to improve recruiting and retention in a challenging employment market. In the midterm, we plan on expanding our public health services. As you're all probably aware, Victor Farmington partnered with the Ontario County Health Department to provide COVID-19 testing, and we've tested thousands of residents at no charge during the pandemic. We plan on expanding our CLIA laboratory services, offering free first aid and CPR training to residents, school districts, the town, village, and other businesses and organizations. And we've recently enacted a community AED program to encourage AED deployment throughout our community. Long-term, we need to make capital investments in new facilities, garage space. We're the only public service right now that can't house all of our vehicles, and purchase additional heart monitors, defibrillators, and CPR machines. Together, we can make a positive impact to ensure the highest quality community-based emergency medical services for years to come. Thank you for the opportunity to present this evening. We appreciate the support from the towns of Victor and Farmington, and I'm happy to take your questions.
Thank you, Jim. Both town boards have received their past 3 audits. Mayor Menzel-Bard, and we also got your 2021 budget, the existing budget for this year. So I'll open up the floor. Victor?
Yeah, Jim, I'd like to add, I did share with both boards a letter that will be an article that actually be going in the Victor newsletter, and it's from your chief and deputy chief. And so both boards I want to share. Again, we talk about the positives, the things you've done for the community, and certainly the COVID testing is something we're very extremely happy with. I just want to share real quickly for I know the Victor board's heard this, and certainly some new news to some individuals, but I tell my own experience with the ambulance. So 2 years ago, actually last week, I had suffered a heart attack at Victor Town Hall, called 911, and Mike shows up, and he's administering, give me the little white pill under the tongue, keep me stabilized, start taking my vitals, things of that nature, and I don't know how long it was, and at some point he mentioned, he said, Jack, I just want to inform you, we don't have an ambulance here. Okay, so I'm kind of like, what's going on? And he said, listen, they're all dispatched, and we've summoned another company. So that was my first experience. December of same year, 2019, another incident at the house, and I think it was within 10 minutes I had a Farmington Victor ambulance. So I've had both ends of the service spectrum from experience myself with the ambulance, and certainly I'm a supporter of the need for additional service for our communities, our growing communities. So I wanted to state that for the record.
Thank you, Supervisor.
And I shared the same experience. My mother-in-law was living with a very elderly person and went into a semi-conscious state at 11 o'clock at night, and there was no ambulance available. They were all dispatched. The one was dispatched. And so we had an ambulance crew come from Canandaigua Hospital, just dropped a patient off at Canandaigua Hospital, and came all the way up to Pumpkin Hook, very, very north part of the town, for my mother-in-law. So, and there's always that time frame when ambulances aren't available, and then we rely on mutual aid.
Jim mentioned the testing, and Ontario County has a annual Choose the Health Awards, and this year Farmington Victor Ambulance was one of 4 recipients that were considered for the award. Unfortunately, Jim, I hope that you were not.
I'll try to hide my disappointment.
Okay, but just being recognized as one of the 4 throughout our county is certainly remarkable, and we certainly appreciate that very much.
Any other board members?
Yeah, I've had all 3 times I needed the ambulance. They showed up pretty quick. I had Jim, Jared, I think Jim again for my couple of trips to the hospital with a heart infection. They did a great job. Jared actually ended up filing a complaint with the medical director, which was substantiated because he recommended a course of treatment that I needed that was for no reason turned down by an on-call doctor. I mean, they got me to the hospital and it was fine, but it was one of those things that, I've had a professional relationship with the ambulance corps for over a decade, and they honestly, they could have just let it go, but he didn't, and he followed through with it and let me know, they said it was right on that, and there was no reason why that medication was turned down, so I do appreciate the service they got, but I've always been looking at my calls.
I also would like to mention that Ontario County will be awarding our next cycle, actually 3 weeks from tomorrow. The Public Safety Committee will actually entertain consideration to choose a consultant to provide us with a study for EMS and fire throughout the county. And we anticipate bordering county, Livingston, within the last 2 years, has gone to a countywide EMS. But yet, places like yourselves still have their own identity and continue to run. It's just under the umbrella of the county. So I don't want anyone to think that we're taking fire trucks away or ambulances and things like that. It's just we're reaching a point potentially that we would need that type of support. We certainly feel, talking to the county administrator, probably EMS would be the first area of need rather than fire. Though there are certain areas of the town, certain areas of the county from a regional standpoint have more of a need for a career environment. But certainly paramedics as well. So that's something that needs you to understand. Everyone should know. That's a 6-month contract that they'll be signing with us. We anticipate it will be February. They come up and present to the Public Safety Committee. So that'll be a guidebook for the county government, probably for the next decade, that we would use as guide for us as we continue to grow as a county. We are one of the 2 counties within the state that continues.
I think the takeaway that I have when we have a joint meeting like this is the general public doesn't understand the financial situation that the ambulance corps is in. We all expect that service to be there when we need it. And we all have stories. Our town clerk would be singing the praises of the ambulance corps if she were here. They saved her son Nick's life with a quick response a couple of years ago. And I'm not exactly sure when the ambulance incorporated, but I know it wasn't there in February of '70 as an 11-year-old when my dad passed away at a young age. And so, you know, you wish that service was there then, and we take it for granted. And we talked about the geography of how large we have to cover and the response time and all of that. So, you know, it's a important discussion. It's an important piece, and the education piece to educate the public, I think, is the bigger piece. I think as we move forward.
This body has talked about district versus contract, and we've had experience the town of Victor as a village, and we've up until a couple of years ago, we used to contract with the village of Victor for fire protection, and we feel that model works. They come to see us annually, we review their budgets. You know, it's the village's fire department, so they were the ones that were the voting body. We just had verbal input to the village board and to the fire chiefs, but they were very, they would listen to us. They were, again, trying to abide by the tax cap, staying under that. District, for 2 reasons. Number one, I feel it's problematic. I think a district, again, with good intentions, could go in a different direction that maybe the residents do not want to see. And the other factor is what I just outlined a few minutes ago. When you have a countywide EMS, why create a district when in 2 or 3 years then you have to abolish that? So it would be my recommendation that we contract with the ambulance.
One thing that people don't understand or realize, general public, when we were kids, all of us, you know, the ambulance picked up quickly hospital. Now it's the hospital. So on an ambulance is a ton of stuff that costs a ton of money and a ton of knowledge to run it from. And that's what we had, that's what I wanted to be talking about that. You know, like you to kind of bring that up a little bit, elaborate a little bit more on it. It's no longer just a character to the hospital, it's an actual little hospital doing something while you're getting it.
Sure, I'd be happy to talk about that. Thank you, President. Let's see if I have a slide that might talk a little bit about that. Don't know that I have one, but actually, let's go to.
Well, Jim's looking through his notes. I'd like to take the time to introduce our new assemblyman, Mr. Jeff Callahan. Thank you for your attendance and your certainly ability to listen and understand our concerns that we have.
John, why don't we go to slide 14?
Slide 14.
Jeff said he's going to hang around a little bit for our town board meeting too.
I thought he was bringing my.
Tomorrow.
So one of the big things that's been driving our organization right now and this need is decreasing volunteerism. EMS itself has turned into really a very strong mid-level career. Our professionals require a lot of education, training, re-education, ongoing recertification. Becoming a paramedic is essentially a 2-year associate's degree. And retaining your paramedic status every, is it 4 years now? I think it was 3 years. Changed it during COVID a couple of times. Every 3 years, the paramedics required to recertify. Every 2 years, our paramedics are recertified in advanced cardiac life support, pediatric advanced life support, pre-hospital trauma life support. Those are the same courses that the physicians in the emergency room certify. When myself or Mike goes to Strong Memorial Hospital, University of Rochester, to recertify in advanced cardiac life support, we're in the same course with the physicians and the nurses and the pharmacists. We have to take and pass the same course. If you turn the way back clock, 20 years ago, 25% of our labor was career-based. Victor Farmington Ambulance only had around 1,500 calls, about 4 calls a day. The vast majority of our calls 20 years ago were your classic ride in the hospital. Somebody broke a leg, somebody didn't feel sick. We would call that basic life support call. Something that could easily be supported by a volunteer leaving their job at home or maybe picking somebody up at the 10 years ago, 60% of our labor was career-based. Victor Farmington increased to about 2,300 calls or 6 a year or 6 calls a day, and about 50-50 in terms of basic life support calls and the more critical calls, the advanced life support calls like you gentlemen mentioned. Today in 2021, we are estimating having more than 2,500 calls this year, more than 7 calls per day. And the vast majority of our calls, more than 70%, require advanced life support now. So we've seen a very significant change in the call volume, and over the course of our history, a very significant increase in our training and the type of equipment that people expect when they pick up the phone to call 911. The recent pandemic, as you can see from this slide, has reminded us all that it isn't just law enforcement and fire services that put their lives and their health and safety on the line for our communities. We saw a significant decrease in volunteerism during the pandemic. People have to ask themselves, why for free am I taking the risk of getting sick and bringing a disease, especially early in the pandemic, when we really didn't understand the severity of this, bringing that disease home to my family. So we find ourselves in a situation where, yes, the ambulances and the equipment and the medications are very expensive. We have to pay for staff to staff the ambulance to have a response. And that staff requires some significant mid-level training and significant ongoing training.
I think when Jared met with Supervisor Mayor and myself, I think you mentioned is about $200,000 per ambulance equipped.
Yes, fully equipped, we're around $200,000.
And right now you have 4.
We have 4 ambulances. We have a chief's car, a deputy chief's car, and a fire car.
And one of the goals for some increased funding was to turn over the ambulances quicker. You know, in other words, you've been stretching the body of the ambulance out many
Yes.
years and swapping chassis, but now maybe you get on a quicker cycle.
We are hoping to do that. In the past, we would use an ambulance until we would keep the body, the box, if you will, on the back of the ambulance, but we would run the ambulance. We're lucky if we can get 110,000 miles out of the ambulance, given the wear and tear. We would replace the vehicle part of the body, put the box back on, and then try to get another full cycle service out before we have to replace. We're hoping to be able to do some more modern equipment. We recently just purchased a new ambulance. We're hoping to have that in service very shortly. And we're hoping that we can increase the cycle time. And again, with the community funding, maybe get some of those ambulances deployed in the community to improve response times across the area.
You also have the cost of replenishing everything you're using. Medicine is not cheap, and every year it goes up quite a lot.
Yeah.
In our field too,
Oh.
you get killed every work.
About 7% of our annual budget right now is spent on supplies.
That's only going to go up.
Drew, you have a question?
Sure, yeah, Drew Kuzma. I just want to disclose, while there's no legal conflict of interest, I do want to disclose because I work full-time with the Fishers Fire District. So there I'm a lieutenant, not a stakeholder with the district. So that removes any conflict of interest between my role as a town board member and my role there. But because I do serve the west half of the town of Victor, the fire service full-time, and I work very closely with Victor Farmington Ambulance, I just want to make that fact known. So that said, Mr. Hood, I honestly think that when I was elected in January of last year, I believe at that first meeting, we allocated the annual funds to the ambulance in the town, about $19,000. And at that time, I think I spoke briefly to the supervisor saying that I was relatively shocked at that amount of money. It's essentially nothing. If you look at Monroe County, the town of Gates, I believe, is 900,000. Henrietta is 700,000. Parrington is like 230, 240. Pittsburgh's around 300,000. So I think that without doubt, if we want a top-notch service, we need to pay for it a little bit. So I think your first 3 points this evening about what we need to do with the funding, second ambulance on the overnight, a third ambulance during the daytime, increasing compensation and benefits. I wholeheartedly, 100% absolutely agree with those 3 things. And I think that we do need to fund the ambulance from the town to offset some of those costs. So I just wanted to show my support for that. And then I guess as a question, I'm looking to understand a little bit, because I really haven't heard numbers yet, how the layout between the 2 towns would be. I'm just looking to get some, I guess, a general perspective on, the financials of it.
So we're proposing an overall additional increase of $1 million. The split between the towns is something that I've kind of left to the towns to decide. So I guess I'd turn that to the town supervisors.
And then, sir, the other question
Yeah.
I guess I had just before I let it go was, in kind of looking to understand where the tax money, and I compared it to Monroe County because it's easy, those numbers are easy to find. A lot of the town funding to the ambulance is used for, I believe, some particular things. So, certain numbers are allocated towards community CPR classes, or in some cases to offset co-pays or costs on the actual residents that they live within the ambulance response area. So I wasn't sure if that was also a part of that plan.
John, if we could go to slide 16 for our online viewers. So this is a proposal we made. The numbers aren't quite what they would be today, but this is a proposal that we discussed with both town boards a couple of years ago. And generally speaking, I know this adds up to slightly over $1 million, but we're looking at essentially the same sort of priority here. Obviously, our first priority is maintaining that small amount of funding that we were getting, which we greatly appreciate. Second priority that you mentioned, Councilman, was employee retention. So we have about $110,000 that we're planning on allocating annually to that. The service improvement, adding the second crew overnights, is a little over $250,000. Having everybody contribute to the ambulance and just business model sustainability is $367,000. Capital improvement, we're looking at some very substantial building repairs, medical equipment and improvement is a little over $170,000. And then expanding the third crew on Monday through Friday. Because we already have sometimes a third crew Monday through Friday, it is actually not going to cost us quite as much to add that third crew full time as it does the second crew full time. So that third crew full time is around $165,000. Does that answer your question as far as the breakout of the?
Yeah, thank you. I appreciate it.
Jim, I have a question for you. What challenges does individuals choosing high deductible healthcare plans present to the district in the first quarter of a calendar year?
So in the first quarter of the calendar year, when we start billing, about 36% of our patients are either self-insured or on insurance plans. Since the Affordable Care Act was enacted in 2011-2012, we've seen a substantially larger portion of our population be moved to slide 18, John. So before the Affordable Care Act, 35% of our population have what we would call like gold style insurance, the old Blue Cross Blue Shield MVP healthcare style insurance, and only about 19% were self-pay. After the advent of the Affordable Care Act, you can see there's been a significant shift in how people are paying for healthcare. The people with full insurance have gone to less than half. We only have 12% of our population has that gold standard of insurance where maybe they have a $50 deductible. 24% now are self-pay. That portion that are self-pay or high deductible in the beginning of the year, when we bill those people, we have to wait for a cycle. We send them a bill, they have to submit it to their insurance company. Their insurance company sends them their payment, less their co-payment, which sometimes isn't a payment at all. We might not see that money till July or August for billing. So we're very negative cash flow at the beginning of the year because of that. You can also imagine the state and federal governments are not the fastest payers when it comes to Medicare and Medicaid. See some people in the audience laughing, but that can cause us a challenge. So Medicare right now is about 50% of our call volume. and Medicaid is about 14%.
I know it's not, you didn't discuss it, but I discussed the breakdown. The Medicare and Medicaid payments are generally speaking less than half of what it would cost to run the ambulance.
Slide 17.
Yeah.
So these are our current billing rates and currently what we get reimbursed by Medicare and Medicaid. And again, keep in mind, 50% of our population is paying the Medicare rate, 14% the Medicaid rate. A typical ambulance call, rough numbers, last year it cost us a little over $1,000 to transport each patient on average. So when we're costing us $1,000 to transport a patient, half of our patients, or more than half of our patients, are paying typically less than $400 a transport. We have to find a way to balance the books. And the only way that we had to do that is to have our insured self-pay patients compensate for the loss we take on the 64% of the patients who have Medicare and Medicaid. Our self-insurance and self-pay rates include about a 6% margin. And that's our buffer to maybe we don't get enough calls this year, is that sort of 6% sliver of a number. So we get a lot of complaints from people that have to self-pay on how high our rates are. But the economic facts with the fact that I can't change the Medicare and Medicaid rates. They're set by law. I have no influence to swing those numbers and make them twice as high as they are. So we have to deal with the fact that we have that volume of Medicare and Medicaid patients now. And we try to compensate. But as I've said, the current business model, this compensation, with only this little sliver of margin we have, doesn't allow us to move and make any improvements in terms of wages or compensations or capital investments or service improvement.
Do you have any projection on what the insurance and self-pay rates would go to under the new model that you're talking about?
So the plan is to leave them where they are, to keep that 60-40 split. If we were to lower our self-pay rates, the percentage that would need to be contributed by the towns would go up. So we're proposing initially to maintain those rates.
And where do you stand on building maintenance, things of that nature?
Well, our building is over 50 years old, Jack. It needs a lot of help. We just actually had one of our air conditioners fail. We're not ADA compliant. We only have enough room for 4 of our 7 vehicles in our building. So ideally, I would like to see us either revamp or build a new facility that's a little bit more modern, has better facilities. Again, I was talking to, last week, I was talking to one of our past presidents, Jim Spot. And Jim mentioned to me that back in the day, we had a rule that you could either have male crews in the building or female crews in the building, but not both at the same time, because we didn't have the facilities to have people jump up and go to the bathroom and change and do things that they needed to do during the overnight. We've made some improvements to be able to do that, but we don't have, for example, separate men and women locker rooms. We only have 2 shower facilities, which really isn't enough for 3 crews during the daytime. So we're finding ourselves right now in a building that's largely 50 years old that isn't big enough or modern enough or compliant enough for the business that we're trying to conduct.
Have there been any thought, I was kind of thinking this, obviously the call line that you're dealing with and you need to staff more crews and growing up, outgrowing that building, to potentially split to 2 locations and move one. I mean, you're pretty central right now, fairly close to the town lines, but maybe move one closer to the village. The Victor be kind of centralized in Victor, and then we'll move one further east into Farmington and have those 2 and then maybe even kind of give up the East Victor building. I don't know if it costs to rehab the whole building. I mean, we dealt with, the county dealt with the sheriff's office. It's a lot to rehab the whole building. Maybe it's more effective to kind of make sure there are 2 locations. No, it's not your fault.
So I didn't want to jump the gun, so we haven't made any formal plans yet. But what we would propose is doing a heat map of where the call volume is, talking to the towns about where they believe they're going to see the most growth over the next, say, 20 or 25 years, and then making some decisions about where to put brick and mortar to best service those areas.
long-term plan.
long-term ones, yeah. I mean, right now, we respond to, our average call response in the town of Farmington is about 7 minutes. Average call response in the east side of Victor is about 6 minutes, and to the Fisher's Fire District is about 9 minutes. We'd like to improve that. I mean, we know there's a need for improvement. That's part of why we're here. We're limited right now, again, with that little 6% margin, that maybe $200 that may taking somebody who has insurance to the hospital. We can't afford to make any changes.
So we're obviously not gonna make any decision tonight, but could you, your staff, provide us with a 2022 budget?
We usually create that in August or September. We'd be happy to provide it.
I'm just
Okay,
like a rough one,
Oh,
2022, if each town gives you 400,000 a piece.
Okay.
And then $1 million a piece, kind of give us an idea of where that money fits within the budget.
yeah, we'd be happy to put that together.
And give us some ideas on that. Because there is a difference. Our town tax rate would be 27, almost 28 cents for 300,000, 37 cents for 400,000, and just a little over 46 cents per thousand for the $500,000 dedicated to the ambulance corps.
And Jim, the capital funding, or excuse me, the money you're looking for today would be earmarked, it sounds like, adding an additional ambulance and staffing. As far as that, the age of the building, things like that, I would ask that you wait. And again, I don't think you have the money to do anything about it today, but ask that you wait until this county-wide study's done.
Mhm.
And that may also provide a roadmap on where areas of the county need some additional assistance and, spreading out as Councilman Bowerman mentioned as well.
I think that would be wise, Chad. That's kind of why we're looking at that as more of a long term.
When Supervisor Inglesby and I met with Jerry, he mentioned if you have the funding available, or part of your, I think it's your board's vision as well, is to do some positive outreach. Again, you've done the COVID testing, but there's some additional outreach that you'd like to initiate in both communities.
Yes.
Would you provide a description of that to the audience?
I'd be happy to. So we participated in COVID testing, as Supervisor Maroney mentioned during the pandemic. We're looking at ways to expand our CLIA license so that we could do like influenza testing. Influenza vaccination for the community would be something we'd be looking to do. As I mentioned, we're looking to be able to provide free CPR services to residents and businesses in the community. Free first aid training, and the board recently voted to implement a AED partnership program to encourage a lot of our businesses and community facilities to install AEDs. One of the things that I'm sure Jared talked to you guys about was the fact that we've been shocked at some of the locations that don't have AEDs in buildings or facilities across our district. So we're looking to partner and provide grants to provide some offset for training and purchase of AEDs, and then being able to support those businesses or those organizations through the process of legally acquiring and installing an AED and operating it in their facility.
Jim, how do we handle the situation? So I'm 20 years older now, and I went to the bathroom, but I fall down in the bathroom, okay? And
Yeah.
I can't get up. My wife can't get me up. She calls 911.
Yep.
And maybe the fire department's the first responders, they help get me up. If not, your crew gets me up. What am I charged for that?
We currently don't bill for lift assists. Billing begins when we start providing services. So if somebody has to be checked out, have a medical evaluation done, have their pulse taken, blood pressure taken, oxygen levels read, blood glucose level read, that sort of thing, there is currently a charge for that. But for a basic lift assist, or we show up at a call and you say, hey, look, I don't need the ambulance, there's no charge.
Thank you. My wife wanted me to ask that question.
Knocks you over.
I don't know.
If she knocks you over, I'll go back to the highest triple.
Mr. Hunt, if I could just clarify the one question, because this is actually another question I do have. $1 million is, I mean, it's a lot of money at the end of the day. If the supervisor falls for 20 years, I understand there's no charge for this only, but standard practice is, we get vital signs, blood pressure, and all that. So with that, there would incur a bill if we're assessing vital signs.
If we're assessing vital signs currently, there is a current bill, yes.
So, and within the state of New York standard practice, you can't release somebody without requiring a set of vital signs.
You are allowed to do a lift assist only.
Okay. And I don't want to cross too far, but my understanding is that's not necessarily standard practice. So I guess my question would be, I mean, when we're looking at that $1 million mark, which I think we need to fund the ambulance properly, I would advocate for ensuring that a certain population of our patients, those that are simply lift assist, truly aren't getting bills.
Now, I think those are wonderful ideas. Again, a lot of our billing practices right now are based on the fact that we're only funded by our patients. So if I don't bill, I don't have an ambulance. Again, you look at the fire service, I can't imagine how you guys would run a fire service at Fisher's or at Farmington if you showed up and one of your houses was burning and the person said, well, I can't afford you.
And I think that's why I'm saying, I think that funding from the tax dollars, I advocate for that. But when we do advocate for that, I want to make sure there are certain maturities that we aren't going to be billing patients that think that their insurance won't cover those payments. That would be a primary concern I have.
We're happy to work with the towns to determine what you guys think the billing rates and practices should be. I was describing our current billing practices. I absolutely agree with you in terms of providing goodwill. I'll mention right now, Victor Farmington was the first agency in our area to provide an opportunity for patients to submit for need and not being able to afford the ambulance. We worked with our billing provider, MedX, and our legal team to ensure a legal process. One of the challenges we actually run into with Medicare and Medicaid is it's against the law for me to provide a service for free that I bill to Medicare and Medicaid, because that would be fraud against the U.S. government or against the federal government or the state government, because I'm giving that service free to somebody else, but I would be charging the federal government or the state government for that. So one of the challenges that we run into is that we have to be very careful about the decisions we make, who we're going to bill and who we're not going to bill. So we worked with our team to create a practice where if somebody does have a financial need and they get a bill from the ambulance, matter of fact, we spoke to somebody on the phone today and encouraged him to contact our biller, MedX. They will fill out paperwork, which they will submit to MedX, and it's standard type stuff, what your income says, your last tax return and stuff. MedX, our biller, sees all that information. And they have a standard operating procedure that we've developed with them where they will determine if that person is eligible for either a reduced bill or a payment plan or possibly even bill elimination. During my tenure as president, and I'm not sure about people before me, but 100% of the recommendations made by MedX for reduced billing or billing changes or payment plans or even bill elimination have been approved. Whatever they send me that says, Mr. or Mrs. Smith is said they really can't afford your ambulance bill and needs a consideration, and they will say that they've reviewed the information that was provided, and then they will make a recommendation, and I've approved everyone that they've made. But we do, I just want to caution you, we do have to be very careful in terms of when we're billing and when we're not billing, just to make sure it's across the board the same for the Medicare and Medicaid.
Sure. I mean, if that was part of an agreement with the towns, that would be applicable within the law. I mean, there are many agencies that do that.
I just wanted to clarify for everyone, because I know a lot of people don't understand the idiosyncrasies of ambulance billing, which I know way more than I ever wanted to know about.
I think at the end of the day, I mean, some of these points are smaller points. At the end of the day, I'm relatively knowledgeable in the services that we deliver in the town, and I wholeheartedly agree that we need to improve the quantity and the compensation to the crews. We really do need to do that.
Appreciate that, Councilman. Thank you.
I guess one of the questions, an issue that was brought to me when I mentioned this, but a coworker was, are we then essentially double billing residents who are paying a tax and if they have their insurance getting billed? For Farmington, it fully funded at about 46 cents per thousand. Our median home prices, it would be about $130 to $150 per year in property taxes. I don't, we're not, it's not that it's nothing, but we're not whacking them with $1,000 tax bill and then a $2,000 ambulance right on top of it. So even if it was one of those things where there's, a mechanism, not that's guaranteed, but that town residents could request a reduction if they had an ambulance, that, okay, I paid $130 in taxes, so, can I get the $130 off my ambulance? I'm not saying guaranteed, but like there could be, obviously there's some discussion about that so that they don't feel like they're being double billed if they do need the service. It's not an excessive amount. Obviously some of the homes that we have in Victor and some over here in Farmington, we're paying a little more than 130, but it's not an excessive rate.
I know the attorneys are all talking about this. I've gotten some hints of some of the stuff going on. I know there's some legal considerations about how that works.
But just so people know, it's ballpark at the tax rate. It's not, it really, the average, property tax would be, most likely about $150, probably less on a home.
Okay, quick question, back to the envelope, kind of, so you're at like 1.7 this year, let's say.
Yep.
You're talking about $1 million increase to 2.7.
Correct.
Okay. So at a 60-40 split, the 40% comes out about $1.80 million. Rough numbers?
The 60-40 split should come out to 1.7 and 1 million plus the additional numbers we have. Let's go back to slide 6. So the patient billing number I kept the same, $1.7 million. The community number is 1, and then we have another about 3% between donations and.
Okay, so $1 million.
Yeah, roughly.
$1.80 whatever,
Yeah.
doesn't matter, not that.
Okay,
Just back of the envelope, just look at.
gotcha.
So the ask is $1 million between us, Farmington, and potentially the village of Victor?
No. So, yeah, a great question. So we would pay this out of the A fund, so that's all residents, village and town.
Just asking the question, just to make sure where we're going with this.
Yep.
Okay. And that'll be up to basically the board to figure out the split?
Yes.
Would it be a 50-50 split? What are we thinking?
I was thinking 50-50, and my rationale is, at one time, we used to be the fastest growing town in the county. We are now sitting in the fastest growing town in the county. Past census,
Because I remind you that in county meetings.
past census, we're the most populated town. Not sure what this next one, it's close. So Fountain Park, the town purchased Fountain Park with East and West Bloomfield a number of years ago. That's, the payment is based on assessed value. Victor's been losing ever since. I think this 50-50 is the best because I think overall, when you look at the geographical square mileage of both towns, our population should be kind of close.
Well, and also that plays into what Councilman Barman was talking about in terms of find out where the hot spots are so that, the bedroom communities of Farmington are covered better, and as the east side of Victor, the west side of Victor is covered better. I think that is, like down the road, but I think that's where we're headed.
I'd like to give the attorneys any comments or questions for Jim at this time?
I think there's been a series of, I think Jeff back in May provided a pretty detailed list of comments regarding the proposed contract. This is the first time hearing that the village will no longer be part of that arrangement, I guess. And I have not seen any responses from VFA's council to your comments. We're waiting for those responses to your comments on the contract. But I don't have any questions per se. I think we're working toward, at least the legal terms of the contract, and awaiting the town boards to come to a decision as to the funding.
Thank you. And just for the public's knowledge, both town boards are in the budget cycle right now. And legally, town boards have to approve their budget by November 20th. We always like to do it earlier than that. Anybody in the audience have a question for Jim? or the town works. Yes, sir, please state your name for the record.
Yes, my name is John Williamson, resident of Fishers. My question actually, Jack Mary had mentioned this was for contract service. Is that the intent that this will be a contract rather than a district fire or a district ambulatory?
That's what I would have, and again, I think that's the proper terminology, entering into a contract with Farmington Victor Ambulance.
So in
Provide
February,
us with ambulance service.
okay, so in February, if a total Ontario value gets mapped out, we could opt to do something different.
And again, John, it'll be interesting to see what they come up with, what the recommendations, because that's what it'll be. It'll be recommendations from the consultant. And there may even be timelines associated with that, so that could certainly change the future. When we talk about spreading out and the need for, Jim mentioned maybe they need another facility somewhere. Well, maybe that facility is on the east side because it's supporting the town of Manchester, or maybe Victor, it's not necessarily in Fishers, maybe it's a southern area to support east and west. So, that's what I visualize coming, one of the outcomes of that study.
And in Farmington, we have 3 fire departments, and then during the budget cycle, some of the fire departments, Farmington, Sharpsville, and Manchester, some of them want a yearly budget, and some of them will work with the town board for a 3-year known budget, with slight increases, and sign off that way. So that's the same way we would do with the ambulance corps every year. The 2 towns would negotiate with the ambulance corps and where we're going. All right, any other questions in the group? All right.
Quick comment.
Yes, sir.
Somebody in Gallahan, just in case you have any extra cash laying around, we'd appreciate, you can look into that for us.
Be happy to orchestrate that for you.
Thank you for joining us this evening.
I'd like to ask town staff, do we have anybody online that has any questions? Anybody online right now that is now thinking of a question? I'd like to ask.
I'd like to make one quick, funny statement. When we talk about 50-50 between Victor and Farmington and the ambulance corps. The concept has been great for all these years. When I was in high school, Dave maybe remembers back when they started that whole process. And it was kind of funny, they procured their property and I Victor over there. And my dad was involved with Victor. My grandfather, Leonard Corey, was at Farmington. They all got together, got a piece of property. They said, we got to do this. And they all joined together. Brought trucks from Farmington, trucks from Victor. We took it from my gravel pit there on the border and hauled it all over there. The towns got together. They did the base work and set the site up. And there was a lot of local help, a lot of volunteer. I remember being in high school right after the time frame that Dave was talking about. So I was given 71, 2, 3, and there they started the fund drive. Our parents were sending us out to pick up envelopes for fund drives. The funny part of that was there was a catalyst that really got my grandfather sparked up and my father, because there was no ambulance. So my grandmother and then my grandparents lived on the Farmington Victor border, had a very serious health instance one time. And of course, there's no cell phones. You're on a dial up with a party line trying to get somebody to come and couldn't get there or anything. So they joked about this later, but it was serious at the time. First person they could get to Victor Hospital was Sherman Cotton. He shows up with a very dark window, black ambulance was going to take her. She says, the only way I'm ever riding in this is for one thing and one thing only. I'm not riding it. So we had to put her in a family car and take her out. And we did. And so that was the catalyst they needed to get to come together. They worked together closely. These 2 townships building something, and that's where they see all these years later with all this money happening again.
For those that don't know the inside joke, that Sherman Cotton showing up the church, right?
It was a hearse.
We're in the funeral.
It was the hearse.
We'll take you to the ambulance.
He was back up and she said, I'm not riding in that. I went for one thing and one thing only. So that helped get it started. But it was a joint venture back then. And we'd love to have it in that way as well.
So Jim, I guess I would offer a few comments to wrap up is that I haven't heard that there'll be no contribution or no contract. So I think Supervisor Ingoldsby's point, the request of 500 per municipality, mentioned 400. You could again provide a 2022 budget, what both of those would look like. We appreciate that.
Be happy to, Jim.
Victor, town board members, any questions?
Not really a question, Jim, maybe you could elaborate on it if you'd like, but I guess just for the crowds, I think it's an important point to make is, especially with this last year, we've had a rough time with COVID, and a rough time meaning staffing is struggling. Paramedics are down, in Monroe County, the city of Rochester cannot cover calls. Towns outside of that area are covering calls into the city, and they're struggling for staffing. So I think that, point just to emphasize is, the increased contributions and benefits to staffing for the ambulance corps isn't necessarily a luxury at this point. I think it's really in part as a necessity because, if I want a paramedic to come to my home, I want them to be skilled, knowledgeable, credentialed, and experienced. And, to a large degree, you have to pay for that. But also now in this last year and a half of the pandemic, we've seen a pretty substantial reduction to the availability of especially paramedic units. So if you listen at all to the radio in Ontario County, Monroe County, you're hearing people struggling for grant funds. And I think that, we didn't particularly note that to that point. And I think that that staffing contribution increase to their benefits is an essential component to keeping and building upon that service. So I just wanted to make that point. I don't know if you had, you're obviously more knowledgeable on that than I am.
John, I just moved to 21. Online audience. So this slide shows our typical average hourly wages over the last 2 years for BLS and ALS. We're competing with other localities and other businesses that want to hire paramedics and EMTs. We're competing with other industries. Walmart recently started advertising $18.50 an hour for a new employee. Why would you want to be in the cold and rain and have to do all this training to be on the ambulance at $17 an hour if you could be working at a big box store and dry and not in somebody else's house or out on the road making $17 an hour? So we're finding ourselves at a place where we really need to start even just an industry standard to compete with fast food places, big box stores, and other employment opportunities for employees. Not to mention, as Councilman Cusimano mentioned, competing with other services to attract talent to staff ambulances.
Can you pay the training costs once somebody's hired as far as like the
Once they're-
recertification of that?
Yeah, once they're hired, we pay for all the training.
Obviously, come on, spend that money and have go elsewhere.
Right. And I know I took a double take on the corner of East River and Jefferson Road, the Burger King had a big sign up there, starting pay $17 an hour. At this time, I want to thank everybody in the audience for showing up. We had some great questions, comments, great presentation. Jim, thank you for your work that showed up tonight. Staff, thank you for running the Zoom. It's a reminder, it will be shared with Victor, so that can be put up at Victor, either their website or however they do that. We'll have it eventually on for Farmington residents to see the whole presentation. On Victor board, both our attorneys, thank you very much. And Michelle's got a bunch of notes to take for minutes.
Thank you, everyone.
Thank you. We'll take about a 5-minute break and then have our town board start here at 7 o'clock or shortly thereafter.
John,
You're welcome to